Hello, my name is Leslie Bell, and I am a doctor of physical therapy, an edema management specialist, and a lymphedema therapist. I own a private practice in Vermont and have been practicing in an orthopedic outpatient setting for 35 years. I started treating lymphedema patients about 20 years ago and have found that the techniques we use for lymphedema treatment and swelling move across many areas of medicine and can help a lot of conditions. But my greatest interest and joy is helping the patients who have primary or secondary lymphedema enjoy a better quality of life. Today we will be talking about several ways that you can manage your lymphedema or post-operative, post-cancer treatment journey. Not all of these areas will apply to every patient, but we hope that you will find it informative and that it will potentially spark some questions and conversations for you to discuss with your healthcare providers. Exercise is vital for a healthy lymphatic system. If you have a drain in place, you may want to limit your arm motion until it is removed. This may help decrease stress on the lymphatic system and allow it to heal. Regaining mobility after surgery is part of a healthy recovery. Pendulum exercises are often prescribed and are a good and safe way to initiate shoulder motion. Some fluid moves via our pump, and our body's pump system operates on movement of muscles, vessels, breathing, organ motion, all of the above to create pressure changes in the body. One of the major pressure changes that are created in the body is when your ribs go up and down. Diaphragmatic breathing is an important aspect of moving lymph fluid. When we diaphragmatically breathe, it's not movement that comes from the belly, it's movement that comes from the entire rib cage moving up and moving down as we inhale and we exhale. That is important because we have one main vessel that comes up through the center of our body, up through the diaphragm, and then ends over here in the left subclavian region. That vessel is very influenced by breathing, but if we don't get the rib cage moving up and down and the diaphragm moving along with it, it won't compress that vessel and move fluid adequately. One of the ways you can tell whether you're able to exhale is to use a balloon. And you can take a balloon, put it in your mouth, breathe in through your nose, out into the balloon. Next time you take a breath, don't pinch that balloon. Breathe in with your tongue on the roof of your mouth, stopping airflow into your nose. You can repeat that 4 times. After 4 breaths into the balloon diameter should be about 8 to 10 inches. That's about how much air we should be able to move and have good breath cycles. After you've blown up the balloon to see if you can move enough air, some things to think about are whether your head is moving with your chest when you exhale. For instance, bucket handle breathing pattern would be something like this. Inhale, exhale, and my head comes down with it. We want that motion to be separate. We want our chest motion to be independent of our head motion, so that when I take a big inhale and then I exhale, my sternum comes down independently of my head. And that ensures that you're getting more motion of your rib cage and more airflow moving through the lower part of your rib cage. If you wonder if your rib cage is actually moving well and you're able to breathe diaphragmatically, you can always check that with a simple TheraBand. So a piece of TheraBand which stretches easily like this can be put around your rib cage. We put it around the rib cage like this. Hold it across the lower part of the rib cage and breathe in and breathe out. And as you do that, you should not feel your shoulders move more than your rib cage or more than your sternum moves. They should all be moving equally.